component of chronic upper respiratory disease in cats. And I tell my students at the university who work with me in our feline program that if you're going to be a good feline practitioner, you have to do two things. You've got to be a good detective, because cats do not give away clues about their illnesses very well compared to dogs. And then secondly, if you want to be a good feline practitioner, you have to be a good ear, nose, and throat doctor, because cats have so many problems in their noses and their throats and different areas. So what I thought we would do is talk about one aspect of upper respiratory disease in cats and show you some clinical examples of some patients, and have you think back to your microbiology classes and your anatomy classes. You probably thought, I don't need to remember all that kind of stuff. But I'm going to show you some pictures today and some cases. So, when we think about the nasopharynx, we're going to talk about this. We're going to use the definition of the nasopharynx. And we're going to talk about its anatomy in just a second. But basically, we're talking about that area behind the nose, above the palate, especially above the soft palate. The caudal aspect of the nose and above the soft palate. That's what we're talking about with the nasopharynx when we're going to talk about the disease. And similar to what happens with bladder diseases in cats, when cats are chronic sneezers or they make other noises associated with their upper respiratory tract, people often say, oh, a cat has upper respiratory disease. But actually there are lots of different individual diseases that cause bladder disease or cause upper respiratory disease. So we're going to talk about one aspect of upper respiratory disease, which is really the back of the nose, not the front of the nose, which is more common. We're going to talk a little bit about the different organisms that can be associated with this, and we're going to talk about what effect our treatments will have on those organisms and predisposing cats to this disease if we don't use the right antimicrobial drugs. Remember that everything is connected inside our head and inside the little heads of cats. Their noses, sinuses, middle ear cavities, everything is connected. We're going to take a look at it. And I used to think that every time I saw fluid inside one of those cavities, that it must be infected. And I realized that, in fact, in some situations, the fluid is not necessarily infected. We'll look at that in just a little while. When we think about the nasopharynx, when you think about diseases that affect the back of the nose, where the nose drains back into the throat, above the soft palate, you can see that one of the big problems that we have is a difficult area to see. So, cats are not going to let you open their mouth and pull the soft palate forward and look in that area. So they have to be anesthetized. And even if we do it cheaply with a dental mirror and look in there behind the soft palate, it can be a difficult area to see. So unfortunately, we have to do it the hard way often, and we have to anesthetize the cat and pass an endoscope into the mouth, curl it around the soft palate, and point it forward. That's expensive. And not every owner is going to allow us to do that. So it's a tough area to examine. Sometimes these cats need to have surgery in addition to medical treatment, as we'll take a look at in just a little while. And lastly, some of these diseases we're going to talk about require long-term treatments, and we may have problems with the owners or the cat being willing to take medications for a long period of time. So we'll look at some of these different issues as we work through this. All right, so here's a sort of a strange picture. You have to get your bearing and look at this picture. You see right here, in this area here, you can see that there is a fleshy mass that is in that area. And when I open, and I have about a centimeter view of that fleshy mass when I have opened this cat's mouth. We're going to see this patient a little bit later on. We've opened this cat's mouth, a young kitten, and we are seeing it right in the back of the mouth with the help of a speculum and some other things. We're seeing a polyp in the back of the mouth. Very difficult to see it right hidden in the back of the mouth. You get a very limited view of the nasopharynx of that particular area. This cat has a polyp called a nasopharyngeal polyp, and we'll look at those in just a little while. Look at some pictures and some cases with regard to this. So it's a tough area to examine. These cats have to be anesthetized, and then that area has to be looked at. The nasopharyngeal polyp. All right, think back to your anatomy days, or those, maybe some of you are studying anatomy right now, and think about the nasopharynx, that area above the soft palate. Think about the fact that air that we breathe through our noses then passes through the back of our nose. The openings at the back of our nose are called the nasal choanae, C-H-O-A-N-A-E, the nasal choanae. And then air goes back across the top of the soft palate down into our oropharynx at the back of our mouth in this area. So the nasopharynx, right above the soft palate, is really the crossroads in that area between where air is going back and food is going back as well. Sometimes food can go the wrong way and go up into the nasopharynx. We'll talk about that in just a little while. I mentioned a little while ago that everything is connected inside our head and inside the little heads of cats. When we think about the nasopharynx, that area right above the soft palate, and I'll show you some pictures in a little while, there are several important structures that are very close to that. One of which is the openings up into the frontal sinuses that sit right here in cats. You may get sinusitis. So cats who develop chronic infections from their nose and then go back into the nasopharynx are at risk for developing infections that go up into their sinuses. And that has some significant prognostic importance because when cats get sinusitis, it's very difficult to clear those infections in the sinuses with antibiotics alone. Sometimes they have to be drained surgically. So the nasofrontal ostia are little holes that go from right in the nasopharyngeal area back up into the frontal sinuses. There are another set of sinuses close by, and I'll show you some CT scans called the sphenopalatine sinuses. I'm sure you remember these from your anatomy days. They can become infected as well if in close proximity to the nasopharynx. And then, especially if cats get infections and inflammation on the whole of the top of their soft palate, that's very close to the openings of the eustachian tubes that connect to the middle ears and allow equilibrium pressure from the air-filled middle ears to the oropharynx and nasopharynx. Some cats with nasopharyngeal disease will have dysfunction of their eustachian tubes. So the eustachian tubes will become inflamed and may not allow drainage of normal secretions from the middle ear cavities, or we may see fluid in the middle ears. So here's a picture of a cat with amazingly large ears, a little young Siamese cat who came to see me with the primary complaint of snoring. Young cat with snoring. The correct term for snoring is stertor, S-T-E-R-T-O-R, stertor is the correct name for snoring. And when I think about cats who come to see me with chronic upper respiratory disease, and the owners tell me, or I ask the owners, is the cat making a snoring sound, those kind of sounds, when it is sleeping or resting, that tells me that the nasopharynx is inflamed. Bentley is a little cat that came to see me from Houston, a young Siamese. And this is a CT scan of Bentley with a cross-section of his head going through his middle ear cavity. You can see a couple of areas here. We're going to look at this a little more closely in a little while. If we look here, there's his nasopharynx, and it should be anything that is black is air-filled, and air-filled is good. And his nasopharynx here, as you can see, is partially occluded with very sticky material over on this side. It should be much bigger than that. His middle ear cavities in both of these areas should be air-filled. You can see the cats have two compartments to their middle ear cavities. There's a bony ridge right there and there. And you can see that they are filled with what looks like gray material, but this is exudate or mucus that is present here associated with dysfunction of his eustachian. And I'll show you a picture of his eardrum in just a little while. So cats who have nasopharyngeal disease often have problems with otitis media. And they may not have infections in their middle ears. It may simply be that their eustachian tubes are swollen because of their proximity to the nasopharynx, and normal secretions cannot be drained. So I usually take a conservative approach to these cats like this, unless their CT scans show me that they've got real significant problems with bony changes in their middle ear cavity. And here's a good example of a cat who's got nasopharyngeal disease with something else that's going on close by with regard to middle ear disease. We'll see some other pictures a little bit later on. Here's this vascular anatomy, and here are some of the anatomic identification marks of the nasopharynx. And when we think about the rostral aspect, that means the front of the nasopharynx. That's the back of the nasal cavity, the nasal coriander. If you have a cat that is anesthetized and you put your fingers in its mouth, you'll feel two little pointed bones right at the front of the soft palate in the mouth. Very sharp bones that point down. Those are the pterygoid annuli, and those give you an anatomic landmark as to the start of the nasopharynx that is above that. And then at the bottom, we're really saying that the nasopharynx extends to the caudal aspect of the soft palate. There are some other markers as well we can talk about. I'm just going to skip over a slide here because I don't need to talk about it. There are some interesting aspects when we look at the microbiology of the upper airway of cats. And again, it's good to think about going back to your classes in microbiology and being able to apply this. In the typical upper airway of healthy cats, we find a mixture of normal aerobic and facultative bacteria like Staphylococcus, Streptococcus, Pasteurella. They are there in small numbers, living happily in normal cats, both gram-positive and gram-negative organisms. If a cat develops an acute virus infection, like from calicivirus or from herpes virus, those are the first bacteria that start to multiply rapidly and start to cause the initial secondary bacterial complication. But in chronic respiratory disease in cats, associated with the nasal cavity or the nasopharynx, we start to see some changes in this microbial flora of the upper respiratory tract, especially if we as veterinarians don't choose the right antibiotics for treating these cats. So if a cat gets treated non-specifically, repeatedly with a drug like amoxicillin or enrofloxacin or another drug repeatedly, without any real thought about the selection, we can in fact cause the microbial flora of that area to become increasingly resistant. One of the things that we found in our clinic with cats who have chronic rhinitis, sinusitis, nasopharyngitis is that these cats often, if we've treated them inappropriately with the wrong types of antibiotics, we'll find that they often develop Pseudomonas infections in their nasal cavities and then nasopharynx as a result of repeated selection of bacteria by using inappropriate antibiotics. Amoxicillin with tributanic acid would be very good for an acute case. If it doesn't respond, then we start to think about using doxycycline or azithromycin. And then if it doesn't respond again, we start to think about using one of the newer generations of quinolone drugs like marbofloxacin in case we're dealing with a Pseudomonas infection. So I typically go through a series of stages of different antibiotics based on what's happening. Interestingly, we find that a lot of our patients who have chronic upper respiratory disease have mycoplasma infections as a complicating factor. And I think mycoplasma seem to like to live in places where there's lots of mucus. So if the cat's producing a lot of mucus, mycoplasma seem to like to live there. And doxycycline and azithromycin are very good antimicrobials for mycoplasma. Mycoplasma are not found in normal cats. So they are an invading opportunist in chronic upper respiratory disease. And anaerobic bacteria are not found in normal cats in the upper airway. This can be an important invading opportunist as well. So we're going to talk about a few diseases here. Let's introduce you to a few diseases of the nasopharynx as we talk about this. This is, you're going to see Patrick down here. Patrick came to see me from the hill country, but he's in the middle of Texas. We've had some terrible weather this summer in Texas. We've had 59 days, and it's going to start again next week. 59 days so far this summer with temperatures above 40 degrees centigrade, 100 degrees, and we've had 2 days of rain since April 1. So we're in big trouble. There are a lot of fires going on at the moment around our area, the area where he came from in the central part of Texas. So we're going to look at him a little bit. We're going to talk about some diseases of the nasopharynx and just look at some pictures. All right. We'll start out with just looking at chronic bacterial infections of this area. And usually, those infections are an extension of a cat who has developed an upper respiratory infection in the nasal cavity, usually secondary to a virus. And then, because exudates drip backwards from the nasal trachea on the top of the soft palate, these cats often develop chronic bacterial nasopharyngitis. So patients like Patrick, who came to see me with a very long history of sneezing, also had in his history a recent history of snoring, indicating that he has now got an extension of these into his nasopharynx. He also had a recent history of coughing. Not only has the exudate come from the back of his nose into his nasopharynx, but has dripped down into his laryngopharynx, and then he had aspirated some of that, and now has bronchial disease secondary to his upper airways. So everything has become contaminated in him with regard to this. If you have a cat who comes in to see you with chronic sneezing, the owners will usually not tell you that their cat is snoring or coughing. You have to ask those questions. They come in concerned about the sneezing. So you have to ask them questions about, is the cat snoring or is the cat coughing? And the other question we ask is, can your cat hear? We want to know whether there's little ear issues. And so people usually say, how do I know if my cat can hear or not? And so we ask them questions about when the people come home from work, does the cat greet them at the door, does it hear them coming in? When you pour food in the bowl or the can opener, does the cat come running to the kitchen? Or does the cat sleep through all of these things that normally attract its attention? So we always ask about how well the cat can hear as well. So one of the interesting things, here's a cat who's got some very nasty, sticky exudate from its nasopharynx. And you can see, here's the glossopharyngeal folds, or the glossopalatine folds at the back of the mouth here. People sometimes call these the fauces, F-A-U-C-E-S, but they're not the fauces. These are the glossopharyngeal glossopalatine folds. Here's the soft palate, there's the tonsil, and there's this very nasty big blob of exudate. Cats have difficulty getting rid of their exudates from their body. You've seen cats who sling their heads trying to sneeze out material or getting rid of material from the back of the throat. And they have problems in two ways. One, they have very sticky exudate, and secondly, they have very narrow nasal cavities, so it's difficult for that material to get out. And exudates like this, cats have a different composition of their exudates to dogs. They have a lot of sialic acid, S-I-A-L-I-C, sialic acid, that makes it much more sticky. So they also have very nasty, sticky material that they have difficulty expelling from their nasal cavity or accumulates in their nasopharynx like this big, nasty blob of material. This came from Patrick, as we'll see in a minute. So one of the ways that we examine the nasopharynx in our clinic is to anesthetize the patient, place an endoscope in the mouth, curl it round behind the soft palate, and look forward. because this is the area we like to take samples from in cats with upper respiratory disease. Up is down and down is up on these slides. So this is the soft palate here and on the top. And this is the nasal choane. And here's a cat who has an immune-mediated disease, probably associated with inhalation of antigen, nasopharyngitis, lymphocytic, plasmacytic. You can see all these lumps and bumps that are lymphoid follicles that are increased in this view. And these are the nasal choane here. In Patrick, who was snoring, remember this picture because we're going to look at his CT scan, you can see that you can barely see his nasal choane, and it's because it is so swollen and full of mucus in that area. And we cultured mycoplasma, and we cultured Pastorella from this area, and were able to treat him reasonably successfully. So this is some pictures that you can see of the nasopharynx. The cat nasopharynx is very, very small, so it's difficult to get a scope in there. This is Patrick, and if we sort of take a look at Patrick and then look at his CT scans, look on the left over here, you should be good at this by now. We're looking at a cut through his head here, and you can see that his nasopharynx, which should be nice and black in there and full of air, has got all this sticky material. You just saw it on the view we just looked at. Remember your anatomy? These are the sphenopalatine sinuses. They should be full of air that looks like this. They're full of fluid and infection. His frontal sinuses up here should be full of air. They should be black. He's got sinusitis. That's a problem for him because that's probably not going to be treatable medically and may need to be graded surgically. And then look, you can see his middle ear cavities here are also filled. He's got problems in both sets of sinuses. His nasopharynx, his middle ears also have problems in his nose. So he came in for nasal problems, chronic sneezing, but actually so many different areas of his head are affected with infection or with inability to drain properly. Probably this is an inability to drain properly here, and probably not an extended infection. This is Patrick. This is Bentley's eardrum. So we just looked at Bentley last time. A little cat with the big ears. And if you look at his eardrum there, we're using a special otoscope. It's a little blurry, but I think you can see a couple of things. We're looking straight down on top of his eardrum. And I think you get a sense that the eardrum may be convex, suggesting that it's being pushed out. And you can see several bubbles here, and where there's bubbles, there's fluid. So he's got a lot of pressure in his middle ears with fluid that is present there. And one of the treatments that we might consider for him would be a myringotomy. We might consider that, which is making a small incision in the middle ear and draining that fluid and culture. We didn't do that on Bentley, but it's one of the things that we might consider doing. So a good otoscopic examination is always important in these patients. Just very quickly, back to my last slides here. Patrick's owner told us that in spite of his ears being filled with fluid here on both sides, she told me that he could hear just fine. So sometimes cats can still hear in spite of having all of this fluid behind their eardrums. Okay, and you can see here's another cat where, just to show you how these infections will go from one cavity to the next in their head. This is not Patrick, this is an oriental short-hair cat from Houston that had sinusitis. And you can see the very thick, sticky material that is present in the sinuses that is being removed here, this exudate, that is usually infected with bacteria. When you see how thick that exudate is, and realize that the hole between the frontal sinus and the nasal cavity and the nasopharynx is only the size of the lead of a pencil, about 2 millimeters, you can understand why it doesn't drain properly. And why sometimes we have to go in and do surgical drainage from these cats. And one of the problems that I have, in spite of having dealt with cats for many, many years, I cannot tell any physical difference in a cat who is presented to me with chronic upper respiratory infection, with a cat who has sinusitis, compared to a cat who does not have sinusitis. There is no clinical difference that I can distinguish. And yet it's an important prognostic difference in cats if they have sinusitis, because usually they will not be cleared or cured with antibiotics. We have to go to the expense of doing CT scans to be able to do that. So that's why there are probably 2 or 3 reasons why a lot of cats do not get cured with our antibiotics. One would be that they often develop resistant bacterial infections like Pseudomonas, and we're not treating them appropriately with the appropriate drugs. And secondly, they may have infections that are sequestered in places, especially the frontal sinuses, that never go away, and then eventually drain back down to the nose and cause another infection. It's no wonder so many of these cats keep coming back. And then the third reason is that they've often had a virus infection that damages the membranes in the nose and predisposes them to recurring colonization by bacteria. Okay, so a little bit about bacterial nasopharyngitis. It usually happens secondary to upper respiratory disease, usually sneezing and snoring. We have to think about which bacteria might be involved. Remember, mycoplasma are often involved. Nasopharyngeal polyps, that sort of a uniquely cat disease, typically happens that we see in young cats. And most of the cats that I see with this disease are less than a year of age. And in spite of dealing this with a number of years, we still don't know why these occur in cats. These are polyps that originate usually on a stalk in the middle ear cavity. There's a little polyp that originates on a stalk. Some people think that it may be associated with an exaggerated inflammation secondary to an upper respiratory infection. But no one's ever found through PCR or other tests evidence of viruses in these polyps. Some people think that it's a congenital defect of the first pharyngeal path. We don't know. I think it's probably a congenital defect. Although many of the cats that we see come from multiple cat households where respiratory disease has been endemic. So here's one that we pulled out. Looks like a little tiny stomach. But this one is about 2.5 centimeters, this polyp, and it's made of granulation tissue covered with respiratory epithelium. And they usually are on a stalk, which can be quite long, but it arises from the lining of the middle ear cavity. And here's the cat that I showed you at the beginning of the lecture, where I said how difficult it is to observe the nasopharynx. This little cat came to see us with problems of snoring, and he couldn't eat because of the size of this polyp that had migrated down into the nasal. Let me just go back a slide here, because I missed the caption up the top. So these polyps start to grow in the middle ear cavity. And then they can choose to go where they want to. Some of them grow down on their stalk, still attached to the middle ear cavity, and grow down the eustachian tube until they end up in the nasopharynx as an obstruction, like the little cat I showed you at the beginning. In some cats, the polyp remains in the middle ear cavity and continues to grow and causes pain and other problems. And in other cats, the polyp decides to migrate out through the tympanic membrane into the external ear canal. So usually they grow down the eustachian tube and then they hang in the nasopharynx, causing snoring and obstruction. This little cat here, we know, has the polyp on this side. Okay, because you can see the eye is abnormal on that side, and it has Horner syndrome. The polyp is grown large enough that it is putting pressure on the nerves that control intraocular and extraocular function. It has Horner syndrome. Remember the 4 or so signs of Horner syndrome? Meiosis, neurological signs, meiosis, which means constriction of the pupil. Ptosis, P-T-O-S-I-S, which means drooping of the eyelid. on that side. Enophthalmos, which means sinking of the globe. So the globe is sort of sunken a little bit. And then protrusion of the nictitating membrane. So these are some of the clinical signs that we see with cats with nasopharyngeal polyps. Snoring, sneezing, nasal discharge, because in fact the infection starts in the nasopharynx and then goes forward. Normally infections go backwards, but in this case, this is occurring in the nasopharynx and the infection goes forward. Weight loss because they can't eat properly because this polyp is dangling in the back of their throat. Horner syndrome, other neurological signs. If the polyp has ruptured into the external ear canal, I'll show you a picture, we may get otorrhea, which means discharges in the external ear canal and ear pain. And some cats will have stridor, which means they'll have laryngeal obstruction if the polyp is big enough in the nasopharynx. And some cats will have such bad laryngeal obstruction with this big polyp that they will fall over and have syncope, and they'll fall over. This is a cat who was presented to me has Horner syndrome again, and came in to me because of syncope. He would fall over because the obstruction from the polyp was so big. That was on a stalk from his middle ear cavity into his nasopharynx. And here's a picture of the polyp. This great big thing. We have pulled it out and ruptured the stalk here. This whole thing was sitting in the back of his throat, preventing normal breathing, normal eating, and was causing laryngeal obstruction. Typically, when we see one of these, we open a cat's mouth and we see one of these, and sometimes they are at the back of the mouth or they are sitting on top of the soft palate and making a bulge in the soft palate. When the cat is anesthetized, we will usually remove them by traction. Just pull them out and rupture the stalk. About 40% of them grow back. But if we treat the cat with corticosteroids at the same time that we perform that traction and remove them like this, we reduce that relapse rate down to about 10%. If we do CT scans on them and we see that the bone of the osseous bulla, the middle ear cavity, is diseased, then we have to go in and do a procedure where we curette out the middle ear cavity, a procedure called a bulla osteotomy. So here's one. We were looking in the external ear canal of a cat, and you can see this fleshy polyp actually protruding, has ruptured through the tympanic membrane and come up into the there. And we know that this cat has got infection in the middle ear because there's no tympanic membrane left. So the chances are we're going to have to go in after we've removed this and pulled it out to clean out that middle ear cavity because it's probably deeply infected and chronically infected. There are different ways of treating this, but typically traction is the way that we do it. And we can reduce the relapse rate by using steroids. So I'm just not going to talk much about that anymore. There's another interesting disease of the nasopharynx in cats. We had one through our clinic recently. We don't see it very often. But cats, at the back of the soft palate, the tissue there gradually scars down until it is almost completely closed and maybe only an opening left the size of a pencil left. The typical nasopharynx for cats at the back, above the soft palate, is probably certainly less than a centimeter in diameter in normal cats. It's very small because of their size. But in these cats, there's a gradual scarring at the back end of the soft palate so that the nasopharynx becomes completely occluded and cannot break backwards. Don't know why that occurs, but one of the theories that it does occur is that it's been seen in cats who were anesthetized for elective surgeries and had some reflux that happened during anesthesia or following anesthesia. And it could be the gastric acid that is reflux may initiate this scarring in the back of the throat. So we just have to be very careful in cats when we're even doing routine procedures that we make sure that their endotracheal tube is removed once we're very comfortable there's not going to be any complications. Because just occasionally reflux can And that appears to be the cause of most of these cases, can cause this scarring that needs to be surgically treated. And we typically use a little balloon to blow up these little circumferential scars and open them up, and that does quite nicely. We can see what else we've got before we finish. Cryptococcosis is a fungal infection. Do we have cryptococcosis in Argentina?
Yes.
Yes, good. Okay. So we see this quite commonly in Texas. We have a lot of infectious diseases in Texas. We're warm enough and hot enough and subtropical in some areas of Texas, but we just have a lot of infectious diseases in dogs and cats, especially tick-borne and flea-borne diseases. This one is cats get this from the soil, but they get two forms of this disease, and I'll show you some pictures. One, this is a fungal infection that cats pick up from contaminated soil, and this organism lives in the soil as a filamentous organism, usually in soil that is heavily contaminated by bird droppings and bird feces. It likes to grow in there. So cats who like to go around under bird feeders and that kind of thing and get in the soil there are at risk. Or it can happen in the nasal cavity, or it can happen in the nasopharynx as a large mass of fungal tissue. Cryptococcosis is one of the many diseases in cats that will also cause retinal problems, and it can cause chorioretinitis. So a very important part of examining sick cats with unknown illnesses is examining their retina, because if they have inflammation in their retina, like this cat, you can see these areas of pink all the way through here and these areas of gray are all areas of inflammation that shouldn't be there. It helps to narrow down the group of diseases that we're talking about, and cryptococcus is one of those diseases. So any sick cat who comes through, especially cats with a chronic fever, we always do a good examination of their retina to see if we can pick up some clues. Here's one of my patients from Houston who has cryptococcus. We have not been able to cure him with treatment, but his nose now is normal. So Rascal looks normal. He's happy, but we've never been able to cure him of his disease after 5 years of treatment. His owners are willing to give him treatment every day. But you can see that the rostral part of the nasal cavity becomes very swollen, and all of this disease tissue is present in here. And then this is an old picture, and I apologize for the quality of it, but sometimes cryptococcosis occurs as a mass in the nasopharynx, and you can see it starting to break through in certain areas here through the soft palate with this big mass that occurs in the nasopharynx. Now, another disease can affect the nasopharynx, and that's neoplasia in older cats. And an important part of any cat's evaluation who comes in to see us chronically sneezing should be a good oral examination and looking for bulges of the soft palate. So I think you can see in this area here, right underneath where the screen is here, there's a sense that there's a bulge right there. So several different diseases might cause that. Cryptococcosis, a nasal tumor in an older cat, a nasopharyngeal polyp that is filling up the nasopharynx and distorting the soft palate, certainly could do it in a young cat. This cat's got a basosquamous cell carcinoma in the nose that is suppressing that soft palate. Neoplasia in cats in this area tend to start in the back of the nose and then spread backwards. Seen in old cats, typically they're presented with nasal discharge, bleeding from the nose, distortion of the nose, snoring, and almost all nasal tumors in cats, unfortunately, are malignant. And by the time we see them, they don't do very well. So here's looking at that same view, back around the soft palate, looking forwards with a couple of old cats, and you can see that there's a tumor here completely obliterating the nasal coatus in the nasal pharynx. Here's the soft palate up here. Remember, up and down. And here's another tumor in the same situation. And it's quite easy to get biopsies from these tumors with the little biopsy forceps going through them. Okay. If you'd like, I'm happy to take questions down here for 5 or 10 minutes, if you've got some questions. Or if you prefer just to come down and ask questions afterwards, I'm happy to do so. I will probably need the help of the translators if you wanted it. I'm sitting at 3:30, and I know you have other things you have to be doing. Are there any questions that anybody would like to ask me from the audience about what we've talked about today? Because I'd be happy to put some headphones on. I'm seeing a question up there. Okay.
Hola. Doctor, yo le quería hacer una consulta.
I can hear you, yeah.
Considerando el efecto guardapolvo blanco en camilla, ¿cuál es la presión normal del gato que se considera normal y a partir de qué presión lo empieza a tratar?
Okay. I didn't talk a lot about blood pressure today because I'm going to be here for a conference this weekend, tomorrow and Saturday, and I have a session on blood pressure there. So, a couple of things about the white coat effect and blood pressure. Interestingly, it is difficult for you and me when we are watching a cat's behavior to determine which cats are stressed while we're taking their blood pressure and which ones are not. Their heart rate and other behavioral characteristics may not give us an accurate representation as to whether they are inappropriately stressed while we're measuring their blood pressure. Typically, the high end of blood pressure in our clinic, normal blood pressure, is 160 milliliters of mercury systolic blood pressure. We don't typically measure diastolic blood pressure routinely in our clinic. And I read recently, and I wasn't aware of this before, that it is rare for the white coat effect to cause blood pressures that exceed 180 milliliters of mercury. So if you have a cat whose pressure is higher than 180, you should be suspicious that it is hypertension due to some underlying disease. So when we are interpreting cats and their blood pressures, we look at several parameters. One, what is the age of the cat? Because most cats who have true hypertension have hypertension because of diseases of older cats. So true hypertension is unusual in cats, in my experience, less than 8 years of age. Secondly, does the cat have an underlying disease, kidney disease, thyroid disease, adrenal gland disease, possibly heart disease, that would put it at risk for hypertension? I have to consider that when I'm evaluating blood pressure. Thirdly, is there any evidence of tissue damage that I can see from high blood pressure, which usually means looking for subtle changes in the cat's retina. And then, are those elevated blood pressures repeatable over time? If a cat comes in to see me and has an underlying disease like chronic kidney disease and has an elevated blood pressure of 170, but no evidence of retinal disease, I'll bring that cat back in 2 days and we'll run another set of pressures and say, is this repeatable? If the cat's already got signs of target organ damage, then I'm not going to wait. So there are a lot of different. The next question was, when do we start treatment? So we know that most cats who are hypertensive will develop damage to their retinas, to their brains, to their kidneys, to their hearts, when their blood pressures consistently are above 170. So anytime that I'm confident with blood pressures above 170, I'm going to treat it, as long as the cat fulfills those parameters. If the cat is sitting at 165, but has target organ damage that is evident, I'm going to treat it. It would be rare for me to treat a cat at 160. So, you okay with that answer? Good.
Y quería hacerle, si es posible, una segunda pregunta con respecto a eso. Considerando un paciente que sea hipertiroideo o que tenga alguna otra condición potencialmente hipertensiva, pero considerando que este paciente sea normotenso en el momento del diagnóstico o en el momento de la consulta, ¿no sería más útil utilizar inhibidores de la enzima convertidora para bajar la presión intraglomerular en vez de la amlodipina?
Okay. I'm not sure that I'm going to answer your question in the way you want it, but we, in our clinic, and there are a lot of different opinions about it, we reserve the use of ACE-inhibiting drugs like enalapril and benazepril. We reserve their use for cats who have glomerular hypertension and proteinuria in the absence of systemic hypertension. We believe it's indicated for those cats. Or we will use it for those cats, for example, with chronic kidney disease and proteinuria, and hypertension, where amlodipine has failed to reduce hypertension and proteinuria to acceptable limits. We will usually use it in those cases with systemic hypertension as a second drug. But we don't use it routinely in cats with systemic hypertension or in cats who do not have proteinuria. Does that make sense? I mean, and that's our approach. But there are other people who will use them more widely than that, but we feel that that's the appropriate way to be selected. Do we have any other questions from the group that I can help answer? Those were great questions. Thank you. If not, I will be down the front here, and I just want to thank all of you again for taking your, Thursday afternoon, and for joining me here and talking about cats. And it was my great pleasure to visit you again at the University of Buenos Aires, and I wish you all the success in your career. Thank you very much.